My name is Adrian. I am a community pharmacist practicing in Calgary, Alberta, Canada, and I'd like to share with you a tool that I hope will assist you as a pharmacist when making prescribing decisions, which I call Got Piesa MinD. So this model of prescribing is based on the World Health Organization's Guide to Rational Prescribing, which was developed in 1995, and married with the tools that the Alberta College of Pharmacists has provided to pharmacists in Alberta that we are required to use and document in our prescribing process. So number 1 is indication. Number 2, goal of therapy. Step 3, prescribe and counsel. So in here we need to determine, is it indicated, effective, safe, is the patient willing to adhere to therapy. Step 4 is monitoring, and step 5 is informative documentation. So when you take these letters, you get a mnemonic that is I Got Piesa MinD. Indication, goals of therapy, prescribe, is it indicated, effective, safe, is the patient willing to adhere to therapy, monitoring, and informative documentation. Let me walk you through an example using I Got Piesa MinD. This is a prescription renewal. So step 1 is defining the patient's problem. So the scenario is that a patient comes to the pharmacy and asks if the pharmacist would renew their prescription for Ramipril. The pharmacist learns that they're taking it for hypertension, and they've been taking it since 2012. They got a previous prescription from a pharmacist already for 14 days worth, but as it turns out, they were forced to reschedule their appointment, and now the patient is out again. Pharmacists in Alberta have the ability to check lab values through a system called NetCare. So the pharmacist would look and determine EGFR and electrolytes turn out to be normal for this patient. Finally, patient checks their blood pressure in the store, turns out to be 130/80. Step 2, what are the goals of therapy? Pharmacist and patient need to have agreed goals of therapy before proceeding in any prescribing decision. So in this case, we want to reduce the risk of complications, and the patient has been given a goal of keeping their blood pressure below 140/90. A great tool for pharmacists is eTherapeutics. A pharmacist can easily check goals of therapy for most conditions there to see if they've missed anything. Step 3 is to prescribe and counsel. So here we have the pharmacist's treatment choice, which needs to be based on evidence and tailored to the patient, not just the condition, not just a med list. We need to look at the whole patient. I am an advocate of always looking at patients' lab values with every prescribing decision. Verifying suitability. This refers to checking, is it indicated, effective, safe, and is the patient willing to adhere to therapy. Next step is the counseling piece of prescribing counsel. I think pharmacists have a pretty good idea of how to counsel on medication. Step 4 is monitoring. This is when to continue, adjust, or stop the treatment, what follow-up is appropriate. So in this case, the pharmacist perhaps reviews adverse reactions that are possible, advises the patient to follow up with the pharmacist if any of those are noted, or if the blood pressure exceeds 140/90. So finally, once this all has happened and the pharmacist has done all that, now they need to find a way to document it. The documentation needs to satisfy the regulatory conditions that are laid out by our college, as well as provide a succinct summary to the primary care physician who's going to receive a copy of this, and hopefully it is in a format that they would actually take the time to read. So, how do we take all this information and put it together in a simple format that is not going to be time-consuming or agonizing for the pharmacist to think about what do I write? It's simple. Just use I Got Piesa MinD. Step 1 is indication, was hypertension. Next, we're going to put down what were our goals of therapy. What did we prescribe? It was Ramipril 10 milligrams a day for 90 days in this scenario. Other information that was relevant when determining what was indicated, effective, safe, and patient willing to adhere to therapy. We have the blood pressure, the relevant lab values, and the date that those lab values were taken. Finally, you have monitoring. So the patient was advised to follow up with the pharmacist if adverse effects are noted or the blood pressure is over 140/90 at rest. Informative documentation is, in summary, this piece of everything on this slide. Got Piesa MinD is a great documentation tool as well as a useful process to every prescribing decision. In much the same way, we like to check every prescription in the same order every time. This 5-step process can simplify every prescribing decision. I hope you find this tool useful in your practice. If you'd like to see more examples of renewals, adaptations, initiations of therapy, or more information of how this tool came to be, please let me know. I'd be happy to share more. Thank you very much.